Good morning. My name is Kim Wilcoxon, and I'd like to welcome you to today's webinar. I'm a partner in the Employee Benefits and Executive Compensation practice of Thompson, Hine, Cincinnati office. Today, I have the pleasure of partnering with Professional Group Plans to walk through a few issues that employers should consider when addressing the end of the COVID-19 emergency. Our goal today is to arm you to help employers deal with what's coming here in a few months. During the presentation, feel free to use the question box in the control panel at the upper right-hand corner of your screen. I'll answer questions at the end of the webinar as time permits. And now I'll go ahead and begin today's program. So to begin with, we wanted to just make sure that we're on the same page about what we mean by the COVID emergencies. So we have two different emergencies that relate to COVID-19. The first being the public health emergency, or PHE. That is declared by the Department of Health and Human Services. It runs on 90-day cycles and can be renewed. It has been renewed a number of times since January 30th. And we recently received word from the Department of Health and Human Services that it has been renewed for the last time. So on February 11th, 2023, the Secretary of the Department of Health and Human Services renewed for one final 90-day period, and in a letter to state governors, confirmed that that would be the last renewal. The other emergency that we have is the national emergency, and that is declared by the President. It runs on one-year cycles, and it can be renewed, and it has been renewed twice since 2020. Now, we have not yet gotten formal communications from the President as to whether or how this emergency will be renewed. But the reason we're talking today is because on January 30th, President Biden sent a message to Congress. And this is in response to a couple of bills that would have immediately terminated both emergencies. And President Biden was essentially telling Congress, look, these emergencies are driving certain things that need to be wound down. People need time to get ready for the end of the emergencies, and we've told people we will give them notice before we terminate the emergencies. So immediately terminating the emergencies, bad idea, vote no on these bills. That's all we had until the Secretary of HHS announced to governors that this would be the last renewal. So we have, I think, as formal as we're going to get communication on the public health emergency. We don't have a formal communication yet on the national emergency. And it's entirely possible that, pressures within Washington can sway this one way or the other. But as of right now, we're sort of looking at May 11th as the tentative end of the national emergencies. So the national emergencies were driving certain changes that could or must be made to group health plans. So what we'll do in the next few slides is walk through the changes that were addressed in guidance or legislation, and what the end of the emergency means for those changes. So to begin with, we have some changes that must apply during the pandemic and may, but are not required to, continue after the end of the emergency. So first, covering COVID-19 diagnostic tests and the related visit at 100%, plus covering over-the-counter COVID tests. After the public health emergency, plans may impose cost sharing on COVID diagnostic testing. They can actually not cover it at all. And they can cease covering over-the-counter drugs, or they can charge cost sharing for it. Something to consider when the employer is thinking about what to do at the end of the emergency. They certainly can continue to pay for tests if they want to. And some employers are thinking, well, our employees have gotten used to getting free tests. Maybe we'll continue this to the end of the year. Some employers may be, wanting more information on the cost, doing some reporting on that to make a determination. But something to think about are the mental health parity rules, which you wouldn't typically think about in a situation like this. But under the mental health parity rules, we can apply, a group health plan can apply cost sharing, so a copay, co-insurance deductible, to a mental health service only if the plan passes a numerical test and is applying cost sharing to enough medical surgical benefits to pass the test. So in order to apply cost sharing to mental health services, we have to apply cost sharing to enough medical services. If we start waiving cost sharing for medical services like COVID-19 tests, that could throw off the results of our numerical, what's sometimes called a quantitative treatment limitation test. So the agencies have said during the emergency, while a plan is required to waive cost sharing, that waiver of cost sharing will not cause a violation of the mental health parity rules, even if that numerical test is thrown off by the waiver of cost sharing. After the end of the emergency, when these waivers are no longer required, that sort of grace from the agencies is not going to apply. And so an employer that wants to consider continuing to cover the cost of a COVID test at 100% after the end of the emergency will need to think about mental health parity. Next, during the emergency, we were required to pay a certain amount for COVID-19 diagnostic testing. Now, for plans with a network of providers, that's easy. The plan negotiates with the provider and they pay the negotiated rate. But for non-network providers, the law said that if there is no agreement between the plan and the provider, that the plan has to pay the provider's posted cash price for the test. Once the public health emergency is over, the plan will no longer be required to pay that amount. So the plan can decide how much is reasonable to pay for an out-of-network COVID diagnostic test. During the public health emergency, we're also required to cover COVID vaccines at 100% in-network or out-of-network. Once the public health emergency is over, we are no longer required to cover out-of-network COVID vaccines at 100%. The plan can impose cost sharing or not cover those vaccines at all. However, the in-network vaccines must be covered because the vaccine is an ACA recommended preventive service. So plans that are subject to the ACA preventive care rules will be required to continue to cover in-network vaccines at 100%. Next, we have a change that was optional during the pandemic and may continue to apply pending further guidance. So during the pandemic, we were allowed to provide first dollar coverage for COVID testing and treatment under a high deductible health plan. And this is important because under the high deductible health plan rules, a plan is required to apply the deductible and cost sharing to anything other than, the plan is not allowed to cover at 100% anything other than preventive care until the employee has met their deductible. So if we pay for COVID testing or COVID treatment, those are not preventive care expenses. And so under our general rules, the plan could not pay for those at 100% without causing all the plan participants to become ineligible to contribute to an HSA. So we have this guidance during the pandemic that we can go ahead and cover that at 100%. We're not going to destroy the qualified nature of the high deductible health plan. And the end of the emergency in and of itself doesn't appear to impact our ability to continue to cover these costs at 100%. The guidance that we received said until future guidance, a high deductible health plan can pay 100% for COVID-19 testing and treatment. Now, I would imagine that as we approach the end of the public health emergency, we will likely get some guidance that may address this issue. So it's not as easy as saying, oh yes, don't worry about it, you can continue to cover this at 100%. We'll need to keep our eye out for guidance on this. But pending that guidance, you should still be able to do this. Keep in mind, however, those mental health parity quantitative treatment limitation rules, if we start waiving too many cost shares for medical services, we could impact the plan's ability to apply cost sharing to mental health services. Now we have some changes that cannot apply after the end of the pandemic. So first, we received some guidance that would allow us to provide COVID-19 diagnostic testing under an employee assistance plan without causing that plan to lose accepted benefit status. And really what this guidance did was it allowed an employer to pay for COVID-19 diagnostic testing outside of the health plan. Generally, anytime you provide medical care, you're providing a group health plan. And a group health plan is subject to a whole bunch of compliance obligations, including plan design obligations under the Affordable Care Act. Well, if a group health plan is an accepted benefit EAP, then it's not subject to a lot of those requirements. So an accepted benefit EAP is an employee assistance program that does not provide significant benefits in the nature of medical care. And so this guidance allowed an employer to tack on COVID testing to an EAP without running in danger of providing significant benefits in the nature of medical care under an EAP. Well, once both emergency periods are over, we no longer have that relief. So if diagnostic testing is provided as part of an EAP, the employer will need to evaluate and determine, does that EAP provide significant benefits in the nature of medical care? If so, then that employer is going to need to be prepared to comply with all of the group health plan rules with respect to that program, or get rid of the COVID testing out of the program. Now, I will say, what is considered significant benefits in the nature of medical care is not clear. We don't have a bright line test to use, so there is some judgment and there is some risk that goes along with treating an EAP as an accepted benefit. Second, on this slide, we are allowed to offer a telehealth-only plan to employees who are not eligible for a medical plan. Similar concept, this allowed an employer to provide telehealth services without bringing in all of the group health plan compliance rules. But beginning with the first plan year, beginning after the PHE, so for calendar years, assuming that the public health emergency ends on May 11th, that would be 1/1/24, the general health plan requirements are going to apply. And so if that telehealth only plan is a group health plan and it's not an accepted benefit, it will need to comply with all of the group health plan rules, including the ACA requirements. And third on this slide is something that probably doesn't have any practical impact anymore, but it's a piece of grace we got from the Department of Labor that said, if you can't meet your deadline for providing a notice or responding to a document request, then the Department of Labor is not going to take enforcement action as long as the plan fiduciary is working in good faith to get that document or notice out as soon as administratively practicable. And that made a lot of sense back in early 2020 when the world had first shut down. Nobody really knew how to work remotely. It wasn't clear if or how you could get your mail or how they could get things where they needed to go. But as we've gone along in the pandemic and we've gotten much, much better at working remotely, it's probably administratively practicable to meet deadlines at this point in time. And so, like I said, this relief may not have any functional impact, but even if it does, that relief will no longer be effective 60 days after the end of the national emergency. Here's a few more changes that may continue to apply even after the end of the pandemic. First being that an employer can provide COVID-19 vaccines under an EAP without losing accepted benefit status. So that discussion that I just had about COVID testing causing an EAP maybe to provide significant benefits in the nature of medical care, we knew that once the public health emergency was over, or both emergencies were over, we no longer had that grace. Well, this grace will continue to apply. The guidance that we have doesn't appear to limit it to the public health emergency or the national emergency. So this is slightly different. It appears that an employer could continue to provide COVID vaccines outside the health plan without bringing in all of the group health plan rules. Then we had a piece of legislation and guidance that would have allowed us to broaden the types of expenses that are reimbursable under a healthcare FSA. We are now allowed to reimburse over-the-counter drugs without a prescription, COVID-19 PPE, and menstrual care products. That guidance, that change was not limited to the public health emergency or the national emergency. It was a permanent change. So a plan could permanently change amend their plan to allow for these expenses to be reimbursed, and that will not be something that they have to undo at the end of the emergency. And then we can provide first dollar coverage for telehealth services under a high deductible health plan. Again, similar to the discussion we had a few slides ago about paying for something under a high deductible health plan that's not preventive care. Telehealth services may or may not be preventive care. And so if a high deductible health plan is paying for telehealth services before someone meets their deductible, that could violate the rules of the high deductible health plan. We have specific legislation that will allow a high deductible health plan to provide first dollar coverage for telehealth services for plan years beginning after December 31, 2022 and before January 1, 2025. So we have until the end of 2024. This is not something that will be impacted by either the end of the public health emergency or the national emergency. And you may have heard in the news, or you may have been following this, that this relief sort of started and stopped a couple of times. You know, it started back in 2020, and we were allowed to go until the end of the plan year that began before 1/1/22. Then there was some legislation that allowed the waiver to occur for calendar months in 2022, April through December. And now we have this guidance that allows us to waive the cost sharing for plan years beginning on or after December 31, 2022. So what does this mean? It means if you've got a non-calendar year plan, there could be a gap in the employer's ability to waive cost sharing for these telehealth services under a high deductible health plan in 2023. So as I mentioned, the new guidance that we have applies for plan years beginning after December 31, 2022. The guidance that we had for 2022 was for calendar months. So if you take a look at this example, let's say you have a plan with a June 1 to May 31 plan year. That plan can provide first dollar coverage from April 1, 2022, because that's the calendar month that the relief started in 2022, through December 31 of 2022, because we had calendar month relief in 2022. But the relief for 2023 doesn't apply until the first plan year that begins on or after January 1, 2023. So we have to wait until June for this non-calendar year plan to be able to waive cost sharing for telehealth services. That being said, there is a special rule under the high deductible health plan rules, which says if you are eligible to contribute to an HSA on December 1, you can be treated as if you were eligible to contribute to an HSA for the whole year, so long as you remain eligible to contribute to an HSA for the whole next year. So even with a non-calendar year plan that can't waive cost sharing, or maybe chooses not to waive cost sharing for those first few months in 2023, individuals who are enrolled on December 1 still could be eligible for the full year's contribution, but they have to remain eligible for a whole nother 12 months. So it gets a little complicated with that special exception, but it is a way that if a plan, you know, couldn't waive the cost sharing for the full year or didn't want to, right, that they can still help their employees be eligible to contribute to an HSA. But it wouldn't be true in all cases, which is where we get very complicated, and you know, it's worth checking with an advisor on that type of thing. So that's sort of a run through of the plan design changes that were impacted by the public health emergency. Now we want to move into a discussion of outbreak period deadline extensions, which are impacted by the national emergency. So as you may remember, back in 2020, we received some guidance from the Departments of Health and Human Services, Labor, and Treasury, which said that during this period we're going to call the outbreak period, we have to disregard that time when applying deadlines for HIPAA special enrollment, COBRA elections, COBRA payments, notice deadlines for COBRA qualified beneficiaries, deadlines for filing a claim, deadlines for requesting an appeal, deadlines for requesting an external review, and deadlines for perfecting an external review. So in most cases, right, the HIPAA special enrollment deadline extensions are going to apply only under a medical plan, because in many cases, an employer's dental and vision plans are accepted benefits that aren't subject to the HIPAA special enrollment rules. The COBRA obviously would apply to medical, dental, vision, healthcare FSA. Any group health plan that's subject to COBRA has to extend their deadlines in response to this guidance. And then all ERISA plans have to extend deadlines with respect to claims and appeals. So that would include even non-health plans like life insurance, disability, and even retirement plans. So this guidance really impacted more than just group health plans. So the outbreak period is defined as the period beginning March 1 of 2020 and ending 60 days after the announced end of the national emergency. That was the guidance we got back in 2020. And the agency said, essentially, stop your deadline clock, right? So if an individual, let's say they had a baby on February 20th, and they had 30 days after February 20th to enroll the baby, they would have their first 9 days in February of 2020, then the clock stops, March 1 of 2020. And it wouldn't start again until end of the outbreak period. And then they'd have their remaining 21 days after the end of the outbreak period to enroll their baby in coverage. That was the initial guidance that we got. Then in 2021, the agency said, oh, this outbreak period has lasted a lot longer than we expected that it would, and we don't actually have authority to require you to disregard a period of more than 1 year. So start that clock again after a year if the outbreak period hasn't ended by then. And then there was a question about, well, how do we apply these outbreak period deadline extensions to COBRA payment deadlines? Because the COBRA payment deadlines are triggered based on the election date, which also has an extended deadline. And so we got some additional guidance on October 6, 2021, which we'll go through here in just a moment. But first, I want to run through a couple of very common situations so that you can help your employers understand, well, what does the end of the outbreak period really mean for these deadline extensions? And I should say, these slides are based on our best understanding, assuming that the national emergency will end on May 11th and the outbreak period will end on July 10th. We are expecting guidance from the agencies to help us, really parse this out. So when that guidance comes out, you'll want to pay attention to that just in case it's different from anything that I'm going to tell you here today. But let's start with HIPAA special enrollment. So under the general rules, plans must permit a special enrollment period of at least 30 days following a special enrollment event, or 60 days if the event is due to a loss of coverage under a state, CHIP, or Medicaid program, or the determination of eligibility for premium assistance under those programs. So we've got our 60-day Medicare and CHIP events, we've got our 30-day events for everything else. Under the HIPAA special enrollment rules, coverage following changes related to birth, adoption, and placement for adoption must be retroactive back to the date of the event. But coverage for everything else can be prospective. So this is a plan design issue. The employer could have chosen to make special enrollment effective the first of the month following the date that the request was made, or they could make it retroactively effective, or somewhere in between. So let's look at an example, again, assuming that the national emergency ends on May 11th and the outbreak period ends on July 10th. So let's say Joe was married on February 14th, 2022. In that case, absent COVID, the deadline would have been March 16th of 2022. But our initial guidance said that the outbreak period must be disregarded. So this event occurred during the outbreak period. We wouldn't even start that 30-day clock running until after the end of the outbreak period. But the disregarded period in this example is more than a year. So under our modified guidance, we can only disregard a year, and we're going to start that 30-day clock running a year after the marriage date. So the deadline to enroll is actually going to be March 16th of 2023. And then the plan terms will determine if Joe does enroll the new spouse by March 16th of 2023, is that coverage retroactive all the way back to February 14th of 2022? Or is it only going to be prospective? So you can see in a situation like this, there's a potential for a very long retroactive coverage period. And some employers looked at this back in 2020 and said, oh, gee, I don't want to have to deal with these really long retroactive coverage periods if I don't have to. And so we're going to make HIPAA special enrollment prospective, except in those limited circumstances where we can't, birth adoption or placement for adoption. When we get to the end of the outbreak period, those employers might want to go back to pre-COVID terms, making all HIPAA special enrollment retroactive back to the date of the event. Or they might want to continue with splitting the effective date, prospective for some and retroactive for others. It's something that's worthwhile for the employer to think about. But so that's our example, assuming that happened before the end of the outbreak period. So what is the impact of the end of the outbreak period? We'll look at this example number 2. And let's assume that Jen had a baby on November 15th of 2022. Her deadline to enroll the baby normally would be December 15th, 30 days later. But we know that the outbreak period has to be disregarded. So we are not going to start that 30-day clock until July 11th of 2023. That disregarded period is less than a year. So Jen doesn't get the full year that Joe got. Jen only gets until the end of the outbreak period. So she must elect coverage for her child by August 9th of 2023. And if she does, that coverage is going to be retroactive back to November 15th, 2022. Something for an employer to think about in addition to, should the coverage be retroactive or prospective when we get to the end of the outbreak period, is how are we going to deal with the fact that employees now owe a significant amount of retroactive premiums? Chances are employees have not saved up for all of this coverage, right? And really, what are the odds that anybody is actually going to ask for this type of retroactive enrollment? It's an excellent question. Employers may not encounter this at all, but if they do, they'll want to think about, well, will they offer a payment plan, or will they require all of the premiums to be paid in a lump sum, in order for the coverage to be effective? All right, so let's think about COBRA elections and payments. So COBRA elections generally must be made no later than 60 days after the election notice is provided. And the COBRA election deadlines have been extended as part of the outbreak period. And here's what I alluded to earlier. The COBRA payment deadline for the first COBRA payment is triggered based on the date of the election. So normally, the COBRA premium is due on the first of the month, and then we have a 30-day grace period to make that ongoing COBRA payment. But for the very first payment, we have an additional 45 days after the date of the election to make that payment. Well, we know that election deadlines were extended and payment deadlines were extended. So the question came up, well, can I take a year and 60 days to elect COBRA and then take another year and 45 days to pay for COBRA? And the agency said, no, we're going to run those deadlines concurrently. So there's a special rule that says the first initial payment deadline will depend upon whether somebody elects COBRA during their initial 60-day period, or whether they take advantage of the outbreak period deadline extensions and elect COBRA after the end of that normal period. So here's another example. Let's assume that we're ending the national emergency on May 11th and the outbreak period ends on July 10th. We know that the outbreak period, but no more than a year, must be disregarded when applying a COBRA election deadline. So let's say Amy's 60-day COBRA election period normally would begin February 20th, 2022. Her election deadline normally would be 60 days later, April 20th of 2022. We know we generally have to disregard the outbreak period, but that outbreak period exceeds 1 year, so we disregard just 1 year, which means that her election deadline is 1 year and 60 days after the date she received her COBRA note, or the date of the COBRA notice. So that's going to be April 20th of 2023. So what does the end of the outbreak period mean? Let's say instead that her election period began February 20th of 2023. So her election deadline normally would be 60 days later, April 20th of 2023. We know that the outbreak period is disregarded. And here, the disregarded period is less than 1 year. So again, Amy doesn't get the full year. She only gets until the end of the outbreak period, which means that her election deadline is 60 days after the end of the outbreak period, or September 8th, 2023. So with that, think about those election deadlines. Now let's think about the payment deadline. If Amy does elect COBRA, when is her initial payment due? So we just talked about the fact that her election deadline has been extended to April 20th of 2023 in that first example. If she elects COBRA during the first 60 days after the date of the COBRA notice, so she didn't take advantage of the deadline extension, her initial payment will be due 1 year and 45 days after the date of the election. So we're giving her an extra year for payment because she didn't take an extra year for the election. So if she elects COBRA April 20th, her initial payment would be due June 4th, 2023, 1 year and 45 days later. But if she took advantage of that deadline extension and elected COBRA after the 60 days, her COBRA payment is actually due 1 year and 105 days after the date the COBRA notice was provided. So that's basically a way of saying you get an extra year, you get 60 days to elect COBRA, you get 45 days to pay for it. We're not giving you more than a year and 105 days. So in this case, her payment would be due June 4th. Now, when we look at what the end of the national emergency means to Amy, again, we look at that example where, she lost coverage in February of 2023. Let's say that her normal election deadline would fall on April 20th. We know that her election deadline is extended to April 8th based on the slide that we saw earlier, which is 60 days after the end of the outbreak period. So if she elects COBRA on or before July 10th, which is the end of the outbreak period, her initial payment will be due 45 days following the end of the outbreak period. That's because her payment deadline, she elected, her payment deadline is based on the date of her election. We're going to disregard the outbreak period. The outbreak period ends July 10th, so we begin our 45-day clock on July 10th. Now, if she makes her initial payment as late as she's permitted to, which is August 24th of 2023, that payment generally has to include premiums for the periods of February 2023 through July 2023. She doesn't have to pay for August because she's in her 30-day payment period for August. Now, if she elects COBRA after July 10th, she's taking advantage of the outbreak period deadline extensions. Remember, she still has 60 days after the end of the outbreak period to make her election. She doesn't get any deadline extension on her payment period because we're outside the outbreak period now, so the normal 45-day rules will apply. So her payment will be due 45 days after she makes her election. So let's say she makes her initial payment as late as she can, October 23rd, 2023. She has to include premiums for the periods of February 2023, which is back the date she lost coverage, through September 2023. Now, that's if, and those sort of, when I say how much premiums have to be included, that's if she wants continuous COBRA coverage. The participants are not required to pay for the entire COBRA period, but they're only going to get COBRA for what they pay for. So if she pays for 2 months of COBRA, she gets the first 2 months of COBRA, but nothing after that. Now, there's a couple of things to think about when we think about COBRA payments. Completely independent of COVID, we have options on how a plan can deal with a participant during the payment period. So ongoing COBRA payments typically are due the first of the month, and then COBRA requires the plan to give a 30-day grace period. Prior to COVID, most plans, I would say, continued coverage during the grace period, thinking that that participant was going to take their extra 30 days. So the plan continued the coverage after the first of the month during the grace period, and then if the participant failed to make premium payments by the end of the grace period, their coverage was retroactively terminated back to the last date for which coverage was paid. Alternatively, you could have terminated COBRA coverage if that payment wasn't made on the initial due date, and then retroactively reinstated it if payment actually was made by the end of the grace period. Well, some employers looked at this option at the beginning of the outbreak period and said, again, boy, we don't want to deal with year-long retroactive coverage periods or continuing coverage and year-long, recoupment of claims that were incurred when somebody doesn't end up paying their COBRA premium. So what we would rather do is terminate COBRA coverage if payment is not made by the initial due date, but tell people we will put that coverage back into place if they make their payment by the extended grace period. This is something that employers like HIPAA special enrollment may want to reevaluate now that the outbreak period is ending. Now that we know we wouldn't have, up to a year of claims to recoup if we retroactively terminated coverage, maybe the employer, for administrative reasons, wants to go back to or, newly continue coverage during the grace period. There's no right or wrong here. It's completely up to the plan and the administrator, but it's something to think about. In addition, there's something that gets overlooked, I think, a lot of times in these rules, which is there is an option for a provider to call a plan and ask whether somebody is enrolled in coverage. If a provider calls during the payment grace period, the plan has to provide a complete answer, which means Let's say you have a plan that continues coverage during the grace period, subject to retroactive termination. The answer during that period should be, yes, they're covered, but they won't be if we don't get their payment by the end of the grace period. Or a plan that terminates coverage, subject to retroactive reinstatement. No, they're not covered, but they might be if they make their payment by the end of the grace period. There's a lot of coordination that has to go into this, especially if your COBRA administrator and your medical plan administrator are two different entities. And so I don't know that we have widespread compliance with this requirement that this type of inquiry be met with, a complete answer. It's something that the employer should be working through with their COBRA administrator and their health plan administrator as they're sort of thinking through these issues. One more outbreak period deadline extension example I want to walk through, because this is one that has caused a lot of administrative headaches for employers, which is the healthcare FSA claim extension deadline. Now, a healthcare FSA is an ERISA plan, and a request for reimbursement is a claim. And so the outbreak period deadline extensions require us to extend the claim filing deadline for the outbreak period, but no more than a year. So let's look at this example one. For claims incurred in 2021, let's say the plan applied a 90-day reimbursement period after the end of the year. So those reimbursement requests would have been due March 31 of 2022. But we have to disregard the outbreak period. In this case, that disregarded period is more than 1 year, so we disregard only 1 year, which means that our claim filing deadline is 1 year and 90 days after the end of 2021, or March 31, 2023. That's a long time to keep the FSA open for reimbursement, especially if the plan has a carryover, because the administrator may have been trying to figure out, well, we don't know how much can be carried over until we know how much has been spent for the year. And so there have been a lot of questions about plan closings and how to deal with the carryover with these deadline extensions. Thankfully, that will go away soon after the outbreak period is over. What's the impact of the outbreak period? Well, let's look at the 2022 claims. 2022 claims normally would have been due March 31 of 2023, 90 days after the end of the plan year. We know the outbreak period is disregarded. The outbreak period here is less than a year. So again, we don't have a whole extra year for the 2022 claims. We just have 90 days following the end of the outbreak period to submit the 2022 claim. So that's the outbreak period, I think, is the biggest headache that employers are going to have to deal with as they approach the end of the COVID emergencies. And so they're going to want to think about, how do we communicate all of this, or do we, to our participants? Well, one thing to notice is there is a general rule that says if you are changing your plan in a way that impacts the summary of benefits and coverage, you have to give 60 days advance notice of that change. Now, would any of these changes that we're talking about here impact the summary of benefits and coverage? It's something that you would want to look at your employer's summary of benefits and coverage to confirm. But even if it is, we got some guidance from the agencies that said if you are making this change as a result of COVID, and at the end of the public health emergency, you plan to just revert back to pre-COVID terms, you don't have to give 60 days advance notice if you previously provided notice about the change and the general duration of the change, or the fact that you were going to automatically go back to pre-COVID terms at the end of the public health emergency. Now, does that mean that no notice is required? Not necessarily. If you have a material reduction in benefits, the ERISA rules would say that you have to give notice at least 60 days after the effective date of the change. So as working with employers, we'll need to understand what changes are they making, if any, in response to the end of the outbreak period? And is this something they have an obligation to communicate? And if so, by when? Even if they don't have an obligation to communicate, is it a good idea? Is it maybe a fiduciary duty to communicate? When we got the sort of, oops, we didn't know the outbreak period was going to last more than 1 year guidance from the Department of Labor, they made a few comments about communicating the deadline extensions to participants. And they talked about the fact that plan fiduciaries, may need to make reasonable accommodations to prevent the loss or undue delay in payment of benefits, right? So your participant, a participant in a plan may think that they have an extra year to make their COBRA payment, and they don't realize that the outbreak period is ending, and nobody tells them that the outbreak period is ending, and so they try to make their payment within that 1 year time. We may need to make some accommodations to prevent them from losing benefits because of this sort of issue. So there may be a fiduciary obligation to make adjustments, to make premium payment plans, to communicate affirmatively the end of the outbreak period. Here's another snippet from that guidance where, the plan administrator, if they know or reasonably should know that the end of the relief period is exposing a participant to a risk of losing benefits, they should consider affirmatively sending a notice regarding the end of the relief period. Plan disclosures that were communicated during the relief period might need to be updated to reflect the fact that we're now changing, we're going back to the normal terms. I can guarantee that employees right now who are used to getting free COVID tests will not remember that they were told back in 2020 that this coverage is only going to last until the end of the public health emergency. So an employer will need to evaluate whether they have a fiduciary duty to notify participants, even if back in 2020 they gave them a heads up about the duration of this change. One last piece of communication I wanted to talk about is the COBRA election notice. And so under the COBRA regulations, the election notices must include a number of different pieces of information, including an explanation of the time period during which the election must be made, the date by which the election must be made, the times during which notices of disability or second qualifying events must be provided, a description of the due dates of payments and the grace period for payment. All of those elements were impacted by the outbreak period deadline extension. I think the most common approach to communicating this for those plans that did was to slap on an attachment on the COBRA notice to explain that, okay, the deadlines in the COBRA notice actually are extended. And in fact, there was litigation claiming that that sort of attachment violated the COBRA regulations because now we have conflicting deadlines and it was confusing the participants. So it may be at the end of the outbreak period as easy as having the COBRA administrator remove that attachment. Or for those in plans that, trying to avoid this litigation risk, actually customize their COBRA notices to sprinkle the outbreak period deadline extensions throughout, they may need to go back to the pre-COVID notice and take those deadline extension descriptions out of the COBRA notice. So next steps, as we're advising employers on dealing with the end of the outbreak period, we're encouraging them, number one, to determine what they want to do from a plan design perspective. Will they revert back to pre-COVID terms? Will they continue any of the changes? Can they? Must they? After the end of the emergencies? Then we're encouraging them to review prior communications and amendments to determine whether additional communications or amendments will be required in order to effectuate the decisions that they're making. So for example, they may have done an SMM, which served as a plan amendment back in 2020, which said we're going to cover the COVID tests only for the duration of the public health emergency. And now they're making a decision to continue those free tests at least until the end of the year. They would need to actually amend their plan, issue a new SMM to make that change, because that coverage is going to sort of automatically expire under its terms based on the original communication. Those are the types of reviews we're encouraging employers to do at this point. Then consider the extent to which communications about post-pandemic plan design must or should be provided to participants. As we just talked about, there may be a fiduciary obligation to do so. And determine whether and how to make additional communications specifically about the outbreak period deadline extensions. Consider how to address those retroactive premium payments. If the employer does have someone who is taking advantage of the deadline extensions and has a pretty significant retroactive coverage period, will there be payment plans? Will the employer require the payment to be all up front? Something to think about. And of course, coordinating with vendors, making sure that whatever the employer wants to do, their vendor can and is programmed to do. And that takes us to the end of the prepared presentation. I'm going to check to see if we have any questions, and it looks like we have one here. Do the COBRA election period rules and changes apply to state continuation rules as well? The answer to that is no, based on the rules that we have discussed today. The rules we've discussed today apply only to the federal COBRA obligations. I guess it's entirely possible that a state may have taken some additional action to provide guidance to extend deadlines. I'm not aware of any, but that doesn't mean it's not the case. So if you have a plan that is subject to state continuation, it may be worth looking at the rules of that state just to be sure no guidance was actually issued. Next question. So to confirm, over-the-counter COVID tests will not be covered once the COVID emergency period ends. They're not required to be covered once the COVID emergency period ends. So when the public health emergency is done, the plan is no longer required to cover over-the-counter COVID tests. Now, if a plan wants to, they're really going to have to coordinate with their vendor, because sort of in the world we're in now, most vendors offered this direct coverage option where a participant could essentially, go to the pharmacy and get a free COVID test without submitting anything, or order tests online. I don't know whether the pharmacy benefit administrators are going to continue that sort of automatic coverage, even if an employer wants to do so. So that's something that would be worth discussing with your medical plan administrator, insurer, pharmacy benefit plan administrator, whoever was in charge of those over-the-counter COVID tests. And that brings us to the end of our questions. So thank you all very much for your time and attention this morning. If you have additional questions that you didn't want to ask or didn't get an opportunity, feel free to reach out to your professional group plans contact, and they can either help you or reach out to me, and we'll figure out a way to get your question answered. Thank you so much.